refresh your session. All right. This informational is brought to you. Oh, I turned my camera off for some reason. I don't know what happened. Okay, so this informational is brought to you by your Family School Partnership Coordinators. That is our team. And last year we were called FECs, but this year our title has changed and we're now Family School Partnership Coordinators. Our main purpose here at GCA is family engagement. We want to always be engaged with you. We all want to always let you know what's going on with the school. We want to always bring you informational sessions like tonight, do orientation. Sometimes we do the newsletters. I know you get those newsletters from us. And so we're just here to keep you abreast as to what's going on at the school. So you hear from us a lot throughout the year, and it's only because we understand the importance of engagement. We know that if we engage and we work together, that your students' success rate will be much higher. So that's why we do what we do. We're happy to be here. We're happy to keep you informed. Our family engagement team consists of 5 now. We've been waiting for our final piece. So we were 4 for a while, but we are now 5. We have Miss Veronica Opani, who is with primary and elementary. We have myself, Sonia Welch, and I'm the Family School Partnership Coordinator for middle school. We have Miss Nayeli Hernandez Monterez, and she is the Family School Partnership Coordinator for high school. She is brand new, and we are so happy and elated to have her. There's Nayeli. Hey. So we're so happy to have her. We are overjoyed. It's been a long time coming. For our leadership and services, we have the fabulous Miss Michelle Gilliard, and we have for special programs, Miss Jennifer Lansing. This is your Family School Partnership Coordinators. I probably don't have to tell you that because I'm pretty sure that you have heard from us quite a bit this year already, and you'll be hearing from Nayeli really soon. So we're excited about that. So what's on the agenda for tonight? Well, we're going to talk about why we're here. We're going to talk about what is sudden cardiac death, what are the causes, prevention strategies, recognition and actions, GCA health screening requirements. So we're going to talk about all of that. Why are we here? Okay, so all Georgia schools, public and private, including charters that have one or more grades 6 through 12, shall hold an informational twice per year regarding the symptoms and warning signs of sudden cardiac arrest. As such informational meetings, an informational sheet on sudden cardiac arrest, which is in the note board. And I should bring to your attention that in the note board, we do have the presentation slides. So if you want to click on those slides and follow along with us, that's fine. Also, make sure you click on them and you can save them to your device so that you can have them. So all of the links that we will be talking about are definitely in your presentation slides. So don't worry. Don't try to figure out, okay, I didn't get this, I didn't get that. Everything that you need is in your presentation slide. So as I said, you will receive that informational sheet on sudden cardiac arrest, symptoms and warning signs. And that's going to be provided to each student, parent, or guardian. In addition to students, parents, and guardians, coaches, and other school officials, such informational meetings may include physicians, pediatrics, cardiologists, athletic trainers, which we have none of those tonight. And I should give a disclaimer, and I will give a disclaimer. We are not medical professions. We're not medical professionals. We're not doctors. We may say some things, some words that may not be quite right, but we're going to try our best to give you this information. And you may say, why are we giving this information? Because our school doesn't have a sports program. We don't have any things like that. But there are times that our students will be with us face to face. So we are required by the Georgia Department of Education to give this information to you. We apologize in advance that we will not be able to answer any of your questions As I said before, we're not medical professionals, but we do want to share this information with you. Okay, so what is sudden cardiac death? And again, forgive us because we're going to read directly from the slides. There won't be any, add-ons or anything like that because as I stated before, we're not medical professions. We're not medical professionals. We may mess up some of the words, but just have patience with us and we'll get through this together, okay? All right. What is sudden cardiac death? Cardiac arrest is the leading cause of death in young athletes. Rare, but when a young, previously healthy athlete dies suddenly on a playing field, communities can be devastated. Young athletes are perceived to be a healthy group of individuals. They aren't supposed to die. Alrighty, stirs up medical attention, discussions, and sometimes finger pointing among school personnel, coaches, administrators, parents, and physicians. Alrighty, some of the causes of sudden cardiac death in young athletes. By various mechanisms, these abnormalities cause the heart to beat out of control. And this is called ventricular fibrillation or VFib. This leads to the inability of the heart to pump blood to the brain, lungs, and the heart itself, causing hypoxic injury, which is a lack of oxygen delivery, and ischemic injury, which is a lack of blood flow and death. That is what sudden cardiac death, that's what happens when someone has sudden cardiac death. So at this time, we have done our introduction. We know what sudden cardiac death is. I'm going to go ahead and pass this on to Miss Nayeli, and she's going to give us some more information about sudden cardiac death. You can go ahead and take it over, Nayeli.
Hi, everyone. Like Sonia said, my name is Nayeli Hernandez Monarres. I am fairly new. I think this is maybe my fourth day. So just very briefly, if you have emailed me with inquiries, I promise I'm on them, but I am learning as we go. So back to our presentation. We're going to talk about some structural abnormalities that happen. The first is that it could be an inherited condition. It may run in families, so a history of sudden death in a family member before the age of 50 may be the only clue to the condition. So we have hypertrophic cardiomyopathy. The heart muscle walls are thickened, which disrupts the blood flow from the heart and disrupts the heart's electrical system during exercise. This can lead to ventricular fibrillation or VFib and cardiac arrest. A history of shortness of breath, chest pain, or syncope or dizziness during exercise may be a clue. A physical exam is usually normal, but a skilled physician in cardiac auscultation may detect a murmur. Again, apologies for the medical jargon in here. Some more structural abnormalities, coronary artery abnormalities. The arteries that supply the heart muscle itself are connected abnormally and may get compressed during exercise and not provide adequate blood flow to the heart muscle. This results in VFib and cardiac arrest. Sudden death is usually the initial clue, but there may be a history of chest pain or syncope with exercise. Marfan syndrome, an inherited condition, so family history may be a clue. Abnormal collagen in the aorta may lead to rupture with exercise. Some features are tall, slender, long arms, legs, fingers, abnormal breastbone, high arched palate, extreme nearsightedness, curved spine, flat feet. These traits in any athlete should raise suspicion of the condition. Oh, can we not hear me? Okay.
We can hear you. I'm going to send a message to Dion to refresh.
Okay, perfect. Thank you. Okay, so moving on. Some electrical abnormalities. Wolff-Parkinson-White syndrome is an extra electrical pathway in the heart that causes rapid heartbeat, leading to VFib. People are usually born with the condition and it can cause chest pain, syncope, and shortness of breath with exercise. Now we have long QT syndrome. which is an inherited rhythm disorder causing fast, chaotic heartbeats, often causing fainting, and this can also result in VFib. It can occur with immersion into cold water, as in swimming and diving. So history of drowning or near drowning in a family member may be the only clue. So some traumatic injuries to the heart. We have commotio cordis, so blunt trauma to the chest from a projectile, such as the lacrosse, baseball, or hockey projectiles, or contact sports such as martial arts at exactly the wrong time in the cardiac electric cycle may induce VFib. It's more common in children due to a thin and compliant chest wall. So now we have an infection, inflammation of the heart muscle. It's usually from a virus. An inflamed heart muscle can't tolerate the stress of strenuous exercise and can go into VFib. Recent viral illness, cold, flu symptoms, fever, or recent exercise recent exercise intolerance may be a clue. Athletes with fever or recent febrile illness should not exercise until they are afebrile or symptom-free and have completed a gradual return to exercise program symptom-free. Again, if you have any concerns, definitely reach out to your pediatricians. They will know all about this. So some prevention strategies. The primary prevention is to recognize the warning signs of sudden cardiac death if they occur. Recognize chest pain, shortness of breath, or syncope with exercise. Syncope in the middle of exercise, which again is just dizziness, versus at the end of a race, or fainting suddenly with loud noises, such as an alarm clock, a phone ringing, or doorbell. That's going to warrant some investigation. Chest pain or shortness of breath, often due to asthma or being out of shape, but these symptoms need to be investigated prior to returning to strenuous workouts. Get a yearly pre-participation physical examination by your primary care physician, usually a pediatrician. Again, the experts, they're gonna know it all. And some more prevention strategies. So sudden unexpected death in a family member before the age of 50 is a red flag to a possible inherited condition and warrants investigation. Drowning or near drowning in a family member could indicate long QT. Family history of known cardiac disorder, Marfan syndrome, or electrical abnormalities of the heart warrant investigation as causes of sudden cardiac death. GHSA requires this form as of August 1st, 2019, and will not accept any other version. And this is endorsed by AEP, AHA, and 5 other organizations. A thorough history of a physical exam by a skilled physician is the primary screening tool in preventing sudden cardiac death. Some more prevention strategies. Mass pre-participation physical screenings in gymnasiums should be discouraged because this format, despite being popular, often doesn't allow for a thorough history or careful cardiac auscultation due to the noisy environment. Performed by a provider that is not the athlete's primary physician, usually an orthopedic surgeon, not skilled in cardiac auscultation. Previous health records are not available, they're unable to update immunizations with this format, and family history may not be reviewed by the parent and may be inaccurate and possibly miss important family historic clues that may be causes of sudden cardiac death. Okay. Let's see. So some recognition and actions to sudden cardiac death, we have to recognize it. Whether you see them collapse or not, you must assume sudden cardiac death is a possible cause. Act quickly, call for help, be trained and certified in hands-on CPR, obtain AED as early as possible and know how to use it. Every minute is critical. Have an emergency action plan and rehearse it. Some personal assignments: CPR, get AED, crowd control, call 911, unlock gate, direct EMS to victim, etc. And equipment location and accessibility, and as always, a working phone. So that's my portion of this. It was nice to, I'm glad that you guys get to see who I am. And I'm sure some of you I will be in very constant communication with soon. So Thank you, and on to the next part.
Hello, good evening. I am Jennifer Lansing, and I'm going to continue with tonight's presentation, and we're going to talk about health screening considerations here at GCA. So the goal of Georgia Cyber Academy is to promote the health of students within the school and the community by providing notice of health screening requirements and considerations. Georgia's immunization requirements and school attendance, which is Form 3231, vision screening, hearing screening, dental screening, Form 3300, the scoliosis screening. Then we also have our health screen considerations notice for 21-22, and all of this, just like the other links, are in the presentation link, which is on the note board. So if you are able to open that presentation, you'll be able to get any of these links to get the information that you're looking for. We also are going to discuss the diabetes medical management plan. Okay, so Georgia's immunization requirements and school attendance, which is Form 3231. All students must comply with the requirements of the State Immunization Code, Certificate of Immunization, Form 3231. Georgia law requires children attending school, kindergarten through 12th grade, to be age appropriately immunized with all the required vaccines at the time of first entry in school. A new entrant is a child entering in a school in Georgia for the first time or entering after having been absent from a Georgia school for more than 12 months or one school year. All students, regardless of grade and including foreign exchange students, must have the Georgia Department of Human Resources Form 3231 immunization certificate marked complete for school unless any of the following situations exist. And to see these situations, if you can go ahead and look at our, if you're wanting more information about that, you can look at our presentation link, and that link will also be in the presentation. New immunization requirements. So 6th grade immunization requirements. All currently enrolled children entering 6th grade on or after July 1st, 2015 must meet the following requirements: 2 doses of the measles vaccine, 2 doses of the mumps vaccine, 1 dose of rubella, or laboratory proof of immunity against each of these 3 diseases, 2 doses of varicella, chickenpox vaccine, or documentation of disease or laboratory proof of immunity. At the time your child entered school, only 1 dose of this vaccine was required. More new immunization requirements. 7th grade immunization requirements effective July 1st, 2015. All children born on or after January 1st, 2002, who are attending 7th grade, and children who are new entrants into a Georgia school in grades 8 through 12 need 1 dose of the Tdap vaccine, 1 dose of the meningococcal conjugate vaccine, and the new requirement for children attending 11th grade in the 2021-22 school year. Before starting the 2021-22 school year, all students entering or transferring into the 11th grade will need a meningococcal booster shot, MCV4, unless their first dose was received on or after their 16th birthday. For more information about Georgia's immunization program or the immunization requirements for school entry and attendance, please click on the link in the presentation, which you'll find on this slide once you open the presentation. And it links to the Georgia Department of Public Health Resources. So some more on vision screening, hearing screening, and dental screening, which is Form 3300. A student, regardless of grade level, who has never been in a Georgia public school must provide certification of eye, ear, and dental examinations on the Georgia Department of Human Resources Form 3300. Any child admitted to school without a certificate must present one within 60 calendar days. Forms may be obtained and completed at the local public health departments or physician's offices. Now we're going to talk about scoliosis screening. In Georgia, scoliosis screenings are required in at least 2 grades, 6th, 7th, or 8th. Scoliosis is a physical condition characterized by a lateral deviation of the spine away from the midline of the body. It is known that 2 children out of every 100 may have scoliosis. If this condition is detected early and appropriately treated, progressive spine irregularity can usually be prevented. The procedure for screening is a simple test in which the child's back is examined and in the standing position and while bending forward. Here are some helpful scoliosis resources from Children's Healthcare of Atlanta, United Way, and then how to check for scoliosis. Your child's primary healthcare provider or a health department can provide complete information for suggested screenings, programs, and any necessary treatment. So again, you can find these links within the presentation link in the group note board, and all of the resources from tonight will be in there. So now we're going to talk about the Diabetes Medical Management Plan. GCA has a Diabetes Medical Management Plan, DMMP, per Georgia State Law, OGCA 20-2-779, and it includes the training of specific school employees in the care needed for students with diabetes. GCA must obtain written permission from the student's parent or guardian to allow monitoring of a student's blood glucose and to administer insulin by injection or the delivery system used by the student. GCA would require this permission at any face-to-face event where monitoring or insulin administration would be needed. And now a summary. So get pre-participation physical done by pediatrician 6 weeks before the season starts. Know accurate family history and be familiar with warning signs and symptoms. Recognize warning signs if they occur. Have all coaches and personnel CPR certified and AED trained. Know where AED is. Have required screenings done for the student's health. And read Project Save. Again, you can find these links within the presentation and the presentation link on the group note board. So that concludes this evening's meeting, and we want to thank you all for coming and joining us. And our attendance link is in the group note board. So if you could go ahead and fill out the attendance link. Thank you. Yes, the attendance link is also in the chat. So if you would please fill out the attendance link to show that you were here tonight, we would really appreciate it. And again, thank you for coming, and we really appreciate your participation tonight. Thank you.